Hey y'all, welcome back to the Pink Envelope. We're doing something a little different today. So I don't know if you guys remember, but it was like the end of last year that I released a video on healthcare sharing. I talked about the different options and the option that I use. And oh my goodness, a ton of questions have come in since. And I've been saying for months now, okay, I'm going to film a follow-up video. And it's finally here. I have been with Crowdhealth, which is a healthcare sharing plan, for exactly 1 year, and I took your top 10 questions and I plan on answering them. I have written notes on my phone so we can say clear, concise, and on track, so this will be short. So first, disclaimer, this video is not sponsored. If you sign up for Crowdhealth because you like it, as mentioned in the last video, it is a refer a friend, and I do get a little bonus off that. It is not insurance. I am not an insurance broker. I am not a legal advisor. I am just here sharing my personal experiences with you guys so that you can just hear what I've done for the last, wow, almost 20 years with healthcare sharing and see if it's a good match for you. Healthcare sharing is an alternative to traditional health insurance. And instead of submitting bills to health insurance and they doing their things, you actually submit your bills to a group and then the group splits them up. It is significantly faster, more affordable, and more friendly, in my opinion. If you want all the details on like the basics, go watch that first video. It has it all up there. I'm going to link it here. It'll be down below also. I'm also going to write a blog post. You can head over to this blog URL. It goes into a little bit more detail on some topics that I'm not going to touch on today, like how does Crowdhealth work? What is the average cost, etc. So go to that blog post to see those things. Okay, let's dive into the questions. So one of the ones I saw the most was asked initially by Nathan, and he said, whose bill submission process is easier? So what you do with healthcare sharing is you gather up actually all of your own bills and you submit them to the crowd sharing or the healthcare sharing plan. So it's much more affordable to join one of these plans because you're doing some of the legwork. In my opinion, Crowdhealth is. They have a phone app that is easy to use and it guides you through the info that they need to get the bill submission process started. Uploading documents is easier with Crowdhealth. You just snap a photo with your phone and upload it. Whereas other healthcare sharing programs, such as Christian Healthcare Ministries and Samaritan Ministries, require you to log in to a website and you have to have a scanner and you have to scan your bills in, upload them, and then fill out the paperwork. I felt like Samaritan is next in line for easy, so Crowdhealth is the easiest. Then Samaritan, then Christian Healthcare Ministries, and there are other ones like Zion, and I'm drawing a blank. I don't know about those. I've never been with them. So Crowdhealth is easy breezy. I think 3 steps. It is super fast. Question number 2, are all healthcare sharing plans faith-based? AKA, do you have to be a Christian to participate? And back in the day, like 30, 40 years ago, yes, but not anymore. Most plans require some type of commonality of conviction of some sort, which is why religion was the initial tie-in. But many plans like Crowdhealth have no religious tie-in, but you do agree to a standard of living, a healthy standard of living. And that is part of your, the pendulum varies for men and women and your age, but you have to fit within that parameter to be able to join. If you go to Crowdhealth's website, which I have it linked down below, as well as on my blog, you can read that for yourself. Okay, question number 3, are there age restrictions? So for Crowdhealth, you have to be over the age of 18. And I think there is don't quote me, but I'm close, under the age of 62, 63, 64, 65, somewhere in your mid 60s, it cuts off. Over 18 and let's say under 65, you can get the exact specific cutoff age once again on the FAQs on their website. Once again, we're agreeing to a standard of living. And right now this could change, right? This is the info as of today. Crowdhealth is growing so fast. This may change. Hopefully not. Goodness gracious, hopefully not. But like tomorrow after I release this video. So that kind of gives you info. If you have kids under the age of 18, they can go into a plan with a parent or guardian of sorts. Okay. Red asked, Does Crowd Health cover alternative care? And the short answer is yes. They carry alternative care as long as it's a real doctor. And I love that they put that asterisk on there because you can't go to your neighbor who is proficient with crystals and oils and get it covered. That's how it works. So it has to be a certified doctor. I go to whole health doctors and they do not practice medicine, but my doctors practice healthy living and all of my stuff has been covered. Holistic and neuropathic treatments performed by licensed or board certified medical practitioners, you should be good. They do not cover acupuncture, chiro, experimental, to my knowledge. So I've never had anything declined, and I go to whole health doctors, not like medicine doctors. So I am super pleased with that. Number 5, do they cover pre-existing conditions? And once again, the short answer is yes, they do. There are certain rules and things to know based on your type of pre-existing condition. You would need to chat with them specifically to find out about that. But the girl who told me about Crowdhealth went in with 2 pre-existing conditions. And I asked her feedback after she had been with them a year and said, how was it? And she's like, wonderful. And I would do it again. So I don't know what her existing condition was, but she gave it a thumbs up with coming with 2 and no problems. I came in with nothing. They have on their website people you can connect with and chat with. And I, even as a member, have a member advocate that I can chat with. So far, my experience in the last year, the customer service, getting questions answered, all of that is very good. 6, what is your average monthly payment? As you can imagine, pre-existing conditions and monthly payment were asked over and over and over and over. It's a great question. So for my family of 4, we pay our membership fee of $200 plus $1.60 because I put it on like my credit card or something. So $201.60 is my total each month they charge for me to be a member of Crowdhealth. And then it varies from there based what I pay based on the number of needs that were submitted by my other Crowdhealth family members. So max crowdfunding I will ever have to pay is an additional $405. So that means I never pay more than $606.60 per month. And I'll let you know, it's very rare that I pay the full $606.60. If we don't have a ton of needs come in, they bring the number down. I'm going to show you literally the charges to my credit card. So as you pop on here, you can see I typically pay much less. This is not sponsored. These are my payments charged to my credit card that I am showing you guys that I have made over the last year. So your membership fee never flexes. The additional to cover actual medical cost flexes. And if they can save us money, they do. And I've been very impressed with the way they allocate so far. If you were thinking about joining, you can use this code right here. This is my referral code. And you get your first 3 months of membership for only $99 a month. That's how committed they are to getting you in and letting you experience it. And so, yeah, save this code because if you want to give them a try, that's a huge savings. Now, that's my family of 4. If you're a family of 1 or 2, the rates are different. Once again, go to the Crowdhealth website, talk to a member advocate. You can even contact them through my Refer a Friend and just be like, I want to learn more. And they're non-pressure sales. They'll just answer your questions. Another great question I got quite a few times was, have I ever gotten into a bind where I couldn't pay or the healthcare sharing took too long to get the money back and pay the bill? And that's never. In any, with Christian Healthcare Ministries, with Samaritan, with Crowdhealth, I've never experienced that. We always keep $500 in an emergency savings that when we're doing well checks or sick visits, we can cover those costs. And so you cover all, well, that's not true. With Crowdhealth, you get a well check per family member, and you can exchange that for a dental appointment or a vision. Now, they don't cover dental and vision, but they place an importance on preventative care. So each family member gets 1 complimentary well check per year. And so if we get sick, we can use that $500 to pay that. Typically, I don't know, it's not that much. $75 to $100, $120, depending on what we do in that visit. And so if it's an emergency and you have to go to the hospital, hospitals cannot ask you for money. They cannot demand money on the spot. So you don't have to worry about that. So if you, with Crowdhealth, if you start your request on the app, and it can be as simple as date, what you think happened, you're done. They know about it. They're going to step in and link arms with you. They'll walk with you and help you pre-negotiate rates for any planned surgeries or post-negotiate rates for any emergencies. Crowdhealth instantly starts working with you, whereas a lot of the others, you're responsible for the negotiations, and then they only step in if you get in a bind. So if you're like me, Enneagram 8, I love negotiating the bills. So I don't relinquish to them until I have driven that rate as far down as possible as a cash pay customer. I'm getting all the discounts and making sure I itemize my bills for any stupid stuff that they sneak in there. And then once I've gotten it where I think is best, I turn it up for them. They check my work. So far, I've done good, and they haven't gotten it any cheaper than I've gotten it, which is so fun. But anyways, I digress. We've had 3 claims for reimbursement since in the last year, and easy breezy. One of them I even submitted wrong in the app, and they just emailed me like, hey, we fixed it. No big deal. It's been processed. And I was like, oh my gosh, that's excellent customer service, because I've submitted bills wrong before with other companies, and they just rejected me, and I had to start all over. It was so infuriating. Crowdhealth did not do that. So to follow up with that, another question I got are sick visits, annuals, and blood work covered? And I feel like these questions go together. So annual visits and required exams and labs are covered. Sick visits and voluntary blood work over $500 is covered. Under $500, you're responsible for. So when I go in for blood work, it's like $50 to $100 for 2 to 3 draws. I wouldn't itemize my bills. Sick visits are about $85 to $120. So that $500 emergency savings, I use that money to pay these things, and I replenish the emergency savings as I can. It's all very affordable since you're not paying a high monthly premium. Also to know, Teladoc and talk therapy are free and included in your plan. So I haven't even paid for a sick visit in forever because my annuals are taken care of. And then when we're sick, we just call the Teladoc. So I actually haven't even had to tap my 500 with Crowdhealth because they have all of these other options, which has been great. Same with the kiddos. They'll do kiddos as well. And so if you have any other questions about that, once again, they can deep dive with you. Mary asked, do you have trouble with people accepting it? And the answer is no. Since Crowdhealth isn't insurance, you're considered cash pay. And I have never had a doctor reject me for cash pay. They like my fresh, easy, fast cash that I hand them. And cash pay, you can still use your debit card, credit card. Basically, up front, they don't have to do anything with the insurance companies. You come in and you instantly hand them money, and it saves them time and money. And then you turn around and submit it. Once again, there are some caveats to that. If you're planning to have a major surgery, you submit it to Crowdhealth in advance, and then they partner with you to negotiate rates. Same thing with an emergency. So there's like little variances there. Those are the top 10 questions that I received. If you have any questions that I did not answer, put them down below and we'll do this again. I'm a little over a year in at this point, and hopefully it doesn't take me another year to film one of these. But I am a huge advocate for healthcare sharing. I have had healthcare sharing for 19 of the last 20 years. 1 year in the middle, we were given insurance with the job that we took, and we hated it. All these deductibles, all of these rules, it was the most infuriating experience ever. With Crowdhealth, you go where you want, when you want, how you want it. Where do you want to go? I love it, and I'm incredibly spoiled by it. I've broken my arm. I've had multiple kidney surgeries. I've had 2 babies, all on healthcare sharing. And I mean, if you look at Crowdhealth and you're like, not necessarily a match for me, maybe you're more in the having babies phase of life, go check out Samaritan. I'll drop a link below. I don't think I have any good discounts or referrals with them. I haven't actually been a member of their their services for about 3 years. It's been about 3 years since I've had Samaritan. I had Christian Healthcare Ministries about 2 years ago. Was not a match for my family. Don't have anything good or bad to say. Just gonna say it wasn't a match for us. And then we've been with Crowdhealth since, and they have been amazing. Make sure you check out that blog post for more details. Questions go below. I hope this is helpful. Entrepreneurs, small business owners, kids freshly getting off their parents' insurance plan. This is for you. I hope that you guys have an absolutely amazing day. And if you have subscribed to my channel, I'm going to see you guys later. Bye, y'all.